Post-traumatic stress disorder or PTSD is a psychiatric disorder that can develop in people who are constantly exposed to traumatic events. People always think that PTSD can only happen to combat veterans, but it actually can happen to anyone. And it's more propense that women develop PTSD than men. PTSD symptoms appear 1 or 2 months after the disorder is developed, and they may always vary. Some people don't present symptoms, but here I'm going to talk about the most common symptoms. Uh, we start with intrusive thoughts and negative feelings, and it's when the patient feels sad or it have flashbacks about the traumatic event that he or she experienced, and they may feel sad, depressed, anxious, and this is not good for the patient. We have avoiding reminders, like they may leave everything that reminds them to the traumatic event, even though they may like it before they develop the disorder. Reactive symptoms is like when they have anger outbursts because they remembered the traumatic event, and they feel angry. I don't know why, but they feel angry or they feel anxious, so they make stupid or crazy things because they are not thinking about what they are doing. We have 4 common ways to treat PTSD, and these 4 common ways are the ones that have worked efficiently in patients. We start with the cognitive process therapy. That is when the therapist tries to modify the memories of the patient so he or she can overcome this event quickly. We have the prolonged exposure to events therapy, when the therapist make the patient remind with objects, things, sounds, or more things the traumatic event to the patient in a controlled way. We have the group therapy, and I think that this is the one that it actually works better because the patient is in contact with people that have experienced a similar event to him or her, and the other people in the group encourage the patient to and tell him that maybe they will act the same way. And finally, we have medication that it's based in antidepressives, pills, so they can control their feelings. I think that medication and group therapy will be the best way to overcome the PTSD because personally, I think that cognitive process and prolonged exposure therapy are not like the most human way to treat the disorder. I think it's not good for the patient because maybe he can develop more the disorder. So I think group therapy and medication will be the best way because the patient has someone that is encouraging him, and that he will not be the only one that acted that way, and the medication will help them to keep her mind clear from everything.